Creating systems of excellence and advancing the health agenda for everyone were at the core of the Ministry of Health's mission in 2013.
And it is rolling out quite nicely.
In 2012, Health Minister Dr. Fenton Ferguson announced that 4 health centers would be transformed into centers of excellence.
Today we are signing the first contract, and it is our expectations that the work will move speedily ahead.
That contract was for the Santa Cruz Health Center in St. Elizabeth. Phase 1 of the work was completed in late November. The same was true for the Darliston Center of Excellence in Westmoreland. Meanwhile, work continues on the Claremont Center of Excellence in St. Anne and Isaac Barrett in St. Thomas.
The whole idea is to improve both the diagnostic requirements, improve the physical infrastructure, inclusive of fencing in terms of security and the general aesthetics, while also improving our equipment base.
The whole idea is to improve primary healthcare services as part of government's stated strategy to advance human capital development. Significant infrastructure improvements were also advanced beyond the perimeters of the centers of excellence. At the primary level, both the Chepsa Health Center in Portland and the Mavis Bank Health Center in St. Andrew were upgraded.
The rehabilitation works included re-roofing, construction of bathroom and laundry facilities, electrical rewiring, erection of a perimeter chain link fence, and installation of additional water storage tanks, among other features.
Secondary and tertiary level health facilities were also improved. Black River Hospital's maternity ward was renovated at a cost of $12 million. $8.3 million was spent upgrading Princess Margaret Hospital's X-ray department. A perimeter fence was erected and work continues on its accident and emergency department. Ground was broken for the expansion of the Cornwall Regional Hospital's hemodialysis unit, even as its kitchen was refurbished and a new standby generator installed. St. Ansbury Regional Hospital's surgical facilities is being expanded and upgraded at a cost of approximately $140 million.
Which entails the construction of a 3,572 square foot building, which will house 2 additional theater suites, staff lounge, and consultants' offices, along with a 6-bed recovery area.
Cabinet also approved the construction of a $200 million medical facility to be built in St. James as part of efforts to boost health tourism in Jamaica. And Bustamante Hospital's surgical ward and burn unit were reopened after a $5.7 million refurbishing project.
It is essential that as the only specialist pediatric facility in the English-speaking Caribbean, the Bustamante Hospital is equipped to manage this increasing number of children and their parents and guardians.
In February, Prime Minister Portia Simpson Miller broke ground for a cardiac wing at the same hospital. It's scheduled to be completed in 2014, significantly reducing the number of children on the waiting list for heart surgeries. And after receiving a concept paper for a child and adolescent hospital in Western Jamaica, the Health Ministry made a submission to the Development Bank of Jamaica to invite private participation. In the last calendar year, millions of dollars were spent upgrading the stock of equipment right across the public health sector.
Life-saving treatment for cancer will be moving at warp speed.
New X-ray machines were bought to improve diagnostic services at the Princess Margaret, Anotta Bay, Maypen, and Mandeville regional hospitals.
The unit eliminates the need for the use of a processor to develop the images, and so it decreases the turnaround time. It also allows physicians to access the images remotely.
Meanwhile, 48 fogging machines costing $9 million were purchased to improve the ministry's ability to fight dengue fever and other mosquito-transmitted diseases. That effort was further supported by 14 new vehicles handed over by the National Health Fund costing $38 million. To improve emergency care, 19 new ambulances were purchased at a cost of $80 million.
As we go forward, annually, we will put additional numbers of ambulances.
The National Blood Transfusion Services storage capacity was expanded with the acquisition of a new refrigerator costing $1.5 million. A 15-seater bus for mobile blood collection services was later donated by the Pan American Health Organization, PAHO.
In collaboration with PAHO, a 5-year strategic plan has been developed. My ministry is pleased to receive 200 wheelchairs, 4 theatre lights, 51 sofas, 40 hospital beds, and 2 stretchers from Food for the Poor.
In addition, the Kingston Public Hospital received over 100 wheelchairs from several non-profit groups valued at $4 million, while the St. Ansbury Regional Hospital accepted an echocardiogram or ECG machine to enhance its diagnostic services. The Portia Simpson Miller-led administration made a commitment in 2013 to apply fiscal prudence in the management of the country's affairs. The Health Ministry was on board, organizing important public consultations on sustainable ways to finance the public health sector.
Whichever mechanism or combination we choose, in the end it must be sustainable and must ensure that the most vulnerable are not marginalized.
In the meantime, the Cabinet granted approval for the phased introduction of the Government of Jamaica GOJ Health Card.
The card will facilitate better monitoring and identification. It will also take into account private health insurance so that instances where charges arise, we can better, adequately and quickly deal with it.
The Health Ministry in 2013 developed a comprehensive plan to tackle chronic non-communicable diseases (NCDs) in Jamaica from 2013 to 2018, and that plan was later approved by Cabinet. A single authority for sexual and reproductive health was created through the integration of the National Family Planning Board and aspects of the National HIV Program. The ministry entered into a partnership with the University of the West Indies and the Jamaica Medical Association to carry out prostate cancer research over the next 5 years. And the delivery of pharmacy services hit a new high as the National Health Fund moved into all hospitals and health centers to provide a more technology-driven, customer-focused, and efficiently managed service.
Under Section 14 and 15 of the Public Health Act, and with the approval of Cabinet, I have executed the public health tobacco control regulations.
With those words, on July 15, 2013, tobacco smoking with its over 40 cancer-causing agents became unlawful in specified public places. In October, Minister Ferguson announced that there had been a 20% reduction in asthmatic admissions to hospitals since the imposition of the policy.
Within another couple of years, you will see as happened in Northern Ireland and other countries, less heart attack, less stroke. And this is not at any big cost. All I ask of Jamaica is for support. That's all I'm asking.
More efficient management of the healthcare system, public-private partnerships, effective primary health care. The Ministry of Health in 2013, supporting human capital development.